Hi, this is Scotty, and this is week 11. I thought that I would talk about trauma this week, and I will try to talk a little bit louder. I know some of you have some trouble hearing me, and I'm trying to record it in a little different way. Um, I found the advanced trauma based practice class very enlightening. Um, I know that we have all heard about the ACEs study, Adverse Childhood Experiences study, that I can't remember what class was that was first brought up in, but adverse childhood experiences and the effect that they have on health later in life. And of course, my understanding is that adverse childhood experiences are somewhat differentiated from trauma, but um, I can tell you that having worked in long term care for 10 years, that even I saw the connections between patients in very serious um, medical conditions and a history of childhood trauma, physical, emotional abuse. Um, I actually used the life story of one of my patients to write about the connection between childhood trauma and adult depression. Um, we learned in the class that even depression among people who have been abused as children is different, presents differently, and responds to treatment differently than trauma in adults who have not experienced childhood trauma. So, in my practicum, I'm doing um, in an outpatient therapy clinic. One thing that, of course, we always do on intake is begin to complete the biopsychosocial assessment. And one of the questions, of course, that we ask during the assessment is, have you ever experienced trauma? And of course, that is a question that has nearly an infinite amount of answers. Um, Typically, when thinking about trauma, at least I think about childhood, physical, sexual, emotional abuse. And of course, there's people that have been in car accidents. There's people who've been, in my area at least, we see people that have been in mining accidents, may have been trapped by a rock underground, and definitely feared for their lives. So we asked that question, and that's kind of where I come into a roadblock. Um, I don't really know how to ask, or I don't feel comfortable safely asking someone, have they ever experienced trauma? Um, we may feel tempted to ask someone, have you ever been abused? And again, that's something that I have a little bit of a hesitancy to ask them. I'm afraid that here in the first visit, we're going to maybe get in a situation where I have somebody reliving trauma or having some um, mental block put up because I've asked that question. So, of course, I think that's one of the most extremely sensitive topics. However, I went into the trauma class believing that most human psychological problems in adulthood and even childhood are related in some way to trauma. I even made the statement in the class that I felt that there's no such thing as a mental illness. There's only the after effects of trauma, and I know that's not necessarily true. I think the professor in the class pointed out that bipolar disorder seems to have a significant physical biological component that may be separate from any childhood trauma. But like I said, working in long term care, I see so many people who have just been who are at the end of their life, and they have what I see is the effects of 70, 80 years of living with childhood trauma. And so I guess my question for this week is, how do you broach the subject of trauma to your clients? Is it something that you just wait for them to bring up? Um, how do you ask the client about trauma when you're doing a psychosocial assessment? What phrasing do you use to carefully navigate any potential feelings? So look forward to hearing back from you. Have a good week. Thanks.